Hello to everyone who's watching this video. My name is Emily Zeig, and this is my admission video for the Adult Gero DNP program. I've spent the last almost 3 years now in the Trauma Neuro ICU at North Memorial. We specialize in all types of stroke care, head trauma, multi-system trauma, post-op complications, spinal surgeries, oral surgeries. We do take postpartum hemorrhages from time to time, and we also take pediatrics from time to time, but for the most part, our patients are young 20s on up, so we really do focus on the adult and geriatric population. In addition to this clinical experience, I've also had experiences in the surgical neuro ICU at the University of Iowa Hospital, as well as their inpatient psychiatric unit, their neuro step-down unit, as well as a cardiology inpatient unit and a pulmonology inpatient unit. So thus far in my career, my focus has really been on adult and geriatric patients. Speaking a little to my motivation on wanting to become a nurse practitioner, my current role right now focuses a lot on the treatment of conditions and events after they've occurred, which I would love to continue doing, but I would also love to shift my focus a little more to the prevention of said conditions and events, which I believe becoming a nurse practitioner will better allow me to do. When speaking specifically to the DNP degree as opposed to other grad level degrees such as the MSN, they have similar pillars, right? The critical thinking, the communication, the leadership, the evidence-based practice. But the DNP just builds on these pillars so much more and further prepares you for advanced level positions. Positions such as advanced leadership roles needing further, extensive knowledge, quality improvement roles, research roles, which are roles that interest me when I'm thinking about my future. And so the DNP degree specifically aligns with my current goals and my current motivators when wanting to go back to school and become a nurse practitioner. When looking at St. Kate's mission, vision, and values, there's a couple different qualities that stand out to me. The mission of educating women to lead and influence is a big one. As a young girl, I remember having a female nurse practitioner as my primary care provider, and I remember telling myself I want to be just like her someday. So having strong female influences, not only for young girls but just for society in general, can show how women are able to transform the world, and that mission is very important to me. When looking at St. Kate's values, there's two different ones that stood out right off the bat: integrity and reflection. I think integrity is one of the most important qualities a healthcare provider can have. There's a lot of distrust and a lot of skepticism in the healthcare system today. So being open and honest and building a trusting relationship right off the bat is super important, and I think is a priority for providers. When looking at reflection, I think it can be easy a lot of the time to just look at the patient and not look at the person behind the patient. So I think taking a step back and reflecting on not only the care that you've provided, but the impact that it's had on the patient is good, not only for the patient and the quality of care that you're delivering, but for yourself to be able to reflect on what you have done and what you're able to do. I think that that's super important for providers to have that skill. Now that I've been in my current role for the past couple of years, I have stepped into more of a leadership mentor role for my newer coworkers, which has been really exciting for me. Not only those, basic med skills, equipment questions, but also those just wanting a second opinion instances, which was really helpful for me when I was a new RN, just having somebody else to bounce ideas off of and saying, hey, this is what I think, but what do you think? And so that's been a really cool experience for me to kind of step into that role. As well as this past semester, I actually was able to take a nursing student, a St. Kate's nursing student, which was really fun. Not only being able to help her through her last semester of school, and helping her through that transition of, from a nursing student to an RN, but it also taught me so much about being a teacher and what is effective and what's not. My role right now involves a lot of patient education, but being a nurse practitioner also involves a lot of patient education. So it allowed me to fine-tune, what teaching strategies worked for different scenarios and things like that. So that's been a really cool experience for me to absorb all of that information and kind of get a better grasp of my teaching skills going forward. When talking about learning styles, there's typically 2 to 3 that work best for me, just depending on the situation. When it comes to skills, I'm definitely a hands-on learner. I like to demonstrate that I'm able to do things, and the muscle memory is really helpful for me to be able to retain those skills. When it comes to readings and lectures, I'm definitely a visual and an auditory person. What's worked best for me in the past is that if we're able to get PowerPoints ahead of lecture, I typically will take notes on the actual PowerPoint during lecture so that I'm able to listen and process the information while also taking my own notes. And then after that, I will take the PowerPoint itself and my own notes and handwrite a little study guide for myself, which not only creates a study guide for me to use, but it also helps me retain that information, which has been super helpful for me. And I know grad school is a step above from undergrad. So, using the skills that were helpful for me during undergrad and just enhancing them to work for me during grad school is going to be my best friend. I have a great support system, so leaning on them and, letting them support me and motivate me is going to be an amazing tool for me to use. I'm a big planner person. I love to use a planner, so just, organizing my classes, my assignments, my exams, things like that is going to be super helpful for me in the long run. Getting close with my staff and my faculty and getting to know them and not being afraid to ask questions. I'm here to learn and I want to retain this information and be the best that I can be. So, reaching out for help is going to be super important if I need it so that I'm able to learn and retain information as I need to be. And, making time for self-care is going to be super important. It's easy to get burnt out in things if you don't make time for yourself. So, keeping up with hobbies and, I like to read, I like to volunteer, I like to see my friends and family. And so, keeping up with that while also making time for school and prioritizing that is going to be super important for me. So those are some skills that I'm going to keep up with during grad school. Thank you so much for taking the time to review my application. I'm very grateful to be able to apply to this amazing program, and I hope everyone watching has a happy holiday season.